Welcome to the SNF Virtual Training Program Part 1. I'm Teresa Rada, and I am your presenter for this training topic. I am a longtime physical therapist with over 30 years of experience in direct patient care, clinical education, and administration across post-acute care settings. Currently, I'm an associate at Apt Associates in Cambridge, Massachusetts. The purpose of this presentation is to review some high-level changes made to Section N medications. Let's begin with the primary objectives of this training. At the conclusion of this activity, you should be able to discuss the revised coding instructions and guidance changes to N0415 and N0450. Also, you should be able to discuss the updates to the guidance for N2001 Drug Regimen review. I'll begin with an overview of the changes. First, N0415 high-risk drug classes, use and indication has replaced N0410 medications received. While there have been no changes to item rationale or planning for care, there is an obvious change in the data element number and title. Next, there have been changes in format and structure. Entering number of days medication received has been replaced by checkboxes. And column 2, indication noted, has been added along with coding option code Z, none of the above. There are also two new medication classes, antiplatelet and hypoglycemic. Here are some additional changes. The data element N0450 antipsychotic medication review has a new definition, gradual dose reduction, along with revised coding tips and the location of relevant resources related to gradual dose reduction. For N2001, there is a new coding tip. And as a reminder, please check the MDS 3.0 manual, version 1.18.11 for more guidance details. Now I will review the changes to Section N in a little more detail. I'll begin with the section intent. There have been a few revisions highlighted here on the slide and on the next. Two medication sections have been added. The first is antipsychotic medication review. The second is a series of data elements addressing drug regimen review. These data elements document whether a drug regimen review was conducted upon the start of a SNF PPS day through the end of the SNF PPS day, and whether any clinically significant medication issues identified were addressed in a timely manner. Now I will review the data element N0415, high-risk drug classes, use, and indication. Here is a snapshot of the item. Please note the addition of I, antiplatelet, J, hypoglycemic, and Z, none of the above, and the addition of column 2, indication noted. For steps for assessment, number 1 now reads, review the resident's medical record for documentation that any of these medications were received by the resident and for the indication of their use during the 7-day look-back period or since admission, entry, or re-entry if less than 7 days. Here are some new coding instructions. Code all the high-risk drug class medications according to their pharmacological classification, not how they are being used. For column 1, check if the resident is taking any medications by pharmacological classification during the 7-day observation period, or since admission, entry, or re-entry if less than 7 days. For column 2, if column 1 is checked, check if there is an indication noted for all medications in the drug class. For each class of medication listed in N0415, the instructions have been revised to align with the structural revisions made to the data element. For example, for N0415A1 antipsychotic, check if an antipsychotic medication was taken by the resident at any time during the 7-day look-back period or since admission, entry, or re-entry if less than 7 days. And for N0415A2 antipsychotic, you would check if there is an indication noted for all antipsychotic medications taken by the resident any time during this observation period or since admission, entry, or re-entry if less than 7 days. There are new coding instructions have been added to the new drug classes N0415I antiplatelet and N0415J hypoglycemic, which also includes insulin. These data elements are coded in the same manner as other medication classes, denoting with a check mark in column 1 the specific medication class taken during the 7-day look-back period and the indication for use of the medication denoted with a check mark in column 2. Another new data element, N0415Z, none of the above, was added and is checked if none of the medications listed were taken by the resident at any time during the observation period or since admission, entry, or re-entry if less than 7 days. There are new coding tips for anticoagulants and transdermal patches. Do not code antiplatelet medications such as aspirin, extended release, dipyridamole, or clopidogrel gel as N0415E anticoagulant. Anticoagulants such as target-specific oral anticoagulants, which may or may not require laboratory monitoring, should be coded in N0415E anticoagulant. And transdermal patches are generally worn for and release medication over a period of several days. To code N0415, only capture the medication if the transdermal patch was applied to the resident's skin during the observation period. There are new coding tips for herbal and alternative medications. Herbal and alternative medicine products are considered to be dietary supplements by the Food and Drug Administration. These products are not regulated by the FDA. Therefore, they should not be counted as medications. Examples would include melatonin, chamomile, and valerian root. Keep in mind that for clinical purposes, it is important to document a resident's intake of such herbal and alternative medication products elsewhere in the medical record and to monitor their potential effects as they can interact with medications the resident is currently taking. For more information, we've included a website, the FDA website. This slide shows new coding tips for opioid medications. Opioid medications can be an effective intervention in a resident's pain management plan, but also carry risks such as overuse and constipation. A thorough assessment and root cause analysis of the resident's pain should be conducted prior to initiation of an opioid medication, and reevaluation of the resident's pain, side effects, and medication use and plan should be ongoing. Here is a new coding tip for antidepressants. Residents who are on antidepressants should be closely monitored for worsening of depression and/or suicidal ideation, behavior, especially during initiation or change of dosage in therapy. Stopping antidepressants abruptly puts one at higher risk of suicidal ideation and behavior. Now I will review the data element N0450, antipsychotic medication review. A new definition has been added. Gradual dose reduction is the stepwise tapering of a dose to determine whether or not symptoms, conditions, or risks can be managed by a lower dose or whether or not the dose or medication can be discontinued. This slide contains new coding tips and resources for gradual dose reduction. Information on gradual dose reduction and tapering of medications can be found in the State Operations Manual Appendix PP, which is the guidance to surveyors for long-term care facilities. And a website has been provided. Prior to discontinuing a psychoactive medication, residents may need a gradual dose reduction or tapering to avoid withdrawal syndrome. Now I'm going to conclude today's discussion with a review of the changes to the data element N2001 Drug Regimen review. There are new coding tips for adverse drug reaction, or ADR. Adverse drug reaction is a form of adverse consequence. It may be either a secondary effect of a medication that is usually undesirable and different from the therapeutic effect of the medication, or any response to a medication that is noxious and unintended and occurs in doses for prophylaxis, diagnosis, or treatment. There is new language to clarify the term side effect. The term side effect is often used interchangeably with an adverse drug reaction. However, side effects are but one of the 5 adverse drug reaction categories, the others being hypersensitivity, idiosyncratic response, toxic reactions, and adverse medication interactions. A side effect is an expected, well-known reaction that occurs with a predictable frequency and may or may not constitute an adverse consequence. In summary, during the presentation today, I covered data element N0415, high-risk drug classes, use and indication, which replaces N0410, medications received. Check boxes are now used instead of entering number of days medications received for each medication class in N0415. A new column was added for medication indication, and 2 new medication classes were added in addition to an option for none of the above. Coding instructions and guidance have been enhanced. And for data element N0450, there is a new definition for gradual dose reduction. For N2001, there are new coding tips for adverse drug reactions. If you have questions about this presentation, please submit them to packtraining@econometrica.com by June 2nd. Select questions will be answered in Q&A sessions offered during the June 2023 virtual live event. Thank you.